You know, in a medical emergency, those first few moments, they're absolutely critical. The time before a professional can get there can feel like an eternity. But knowing the right first steps, that's not just useful. It can make a life-changing difference. So let's break down what you really need to know.
Okay, so let's just jump right in with a question for you. If someone suddenly collapsed or started having a seizure right in front of you, would you honestly know what to do? Would you feel confident? Look, it's a tough question to ask yourself, but that's exactly why we're here, to tackle it head on.
So here's how we're going to break it all down. First up, the big ones, the red alerts. When you have to call 911, no questions asked. Then we'll talk about how to keep someone safe during sudden events like a seizure. After that, we'll get into some common warning signs. And finally, we'll wrap it all up with the kind of mindset you need to handle any emergency.
All right, let's dive into our first section, Red Alert. We're starting here because these are the situations where you just can't hesitate. Every single second counts, and your first, most important job is to get the pros on their way.
Okay, this is a really important one to get right. Telling the difference between angina and a heart attack. They can both cause chest pain and make you feel awful, but here's the one thing you need to look for. With angina, the pain usually gets better with rest. But with a heart attack, that pain doesn't let up, it sticks around. And that persistence, that's your big flashing sign to act immediately. So if you even think it might be a heart attack, you've got to move fast. First thing you do always is call 911. While you're waiting for help, get them into a half-sitting position. It just makes it a little easier on their heart. If they're not allergic, have them chew an aspirin. And then you just stay with them, keep an eye on them, and be ready in case things get worse.
All right, let's talk about another major medical emergency, a stroke. This is what happens when the blood supply to the brain gets cut off. And the word you really need to remember here is sudden. Everything happens suddenly. Sudden weakness in an arm, sudden trouble speaking, a sudden killer headache. Those are huge red flags. Luckily, there's an amazing, super simple tool to help you spot a stroke. It's the acronym FAST. So F is for face. Ask them to smile. Does one side of their face droop? A is for arms. Ask them to raise both arms. Does one arm drift downwards? S is for speech. Can they repeat a simple sentence, or is it slurred and strange? And T is for time, because if you see any of these signs, it is time to call 911. Don't wait.
Okay, next up is anaphylactic shock. This is a really scary, really fast-moving allergic reaction. You'll know it when you see it. They'll have trouble breathing, maybe their tongue or throat will start to swell. Your two immediate jobs are, 1, call 911, and 2, if they have an EpiPen, help them use it. Helping them sit up might also make it a tiny bit easier for them to breathe.
All right, moving on to our second section. Here, we're talking about those sudden, really frightening events where your main job is just to stay calm and keep the person safe and stable until things pass or help arrives. Let's start with seizures. Now, this is so important. Your job is not to stop the seizure. You don't try to hold them down. Actually, trying to restrain them can do way more harm than good. Your single most important goal is to protect them from hurting themselves on their surroundings. So what do? It's all about safety. First, get anything hard or sharp out of the way. Shove furniture aside if you have to. Then, cushion their head with something soft, like a folded jacket. Loosen a tie or a scarf around their neck. And, this is key, time the seizure. If it lasts for more than 5 minutes, that's your cue to call 911. Afterwards, just gently roll them onto their side.
Fainting, on the other hand, can look really scary, but it's usually not as serious as it looks. And the treatment is surprisingly simple. Just have them lie flat on the ground and raise their legs up a bit. That's it. Gravity will help get the blood flowing back to their brain, which is exactly what they need.
Okay, on to Section 3. Here, we're going to zoom in on some specific warning signs for common illnesses. It's all about learning to recognize the symptoms so you know what to do next.
This is absolutely vital for anyone who has diabetes or knows someone who does. Low blood sugar and high blood sugar, they can look kind of similar, but the treatments are polar opposites. For low blood sugar, hypoglycemia, they'll be shaky, confused, maybe sweaty. They need sugar fast. Think juice or candy bar. For high blood sugar, hyperglycemia, they'll be super thirsty and need to use the bathroom a lot. They need their prescribed insulin. You have to get this one right.
Okay, this is a simple trick that could literally save a life. It's called the glass test for meningitis. A specific kind of rash can be a major warning sign. So you take a clear drinking glass and you press it firmly against one of the spots.
If that rash doesn't fade, if you can still see the spots clearly through the glass, that's a major red flag. You need to get medical help and fast.
Now, of course, not everything is a 5-alarm fire, right? Sometimes first aid is just about comfort. For migraines, a dark, quiet room is your best bet. A warm compress can work wonders for an earache. A hot water bottle for a tummy ache, and if someone is vomiting, the most important thing is just to keep them hydrated with tiny, frequent sips of water.
Okay, I have to stop for a second, because this is incredibly important. It's a critical warning. You should never, ever give aspirin to a child. It's been linked to a rare but incredibly serious condition called Ray's syndrome. Just don't do it. There are other options for pain or fever.
All right, we're at our final section. This is where we pull everything together. Because this stuff isn't just about memorizing steps, it's about having the right mindset, a set of principles that will guide you no matter what's happening.
So what is that mindset? Well, it really boils down to just a few core ideas. First, and I can't say this enough, try to stay calm. Take a breath. Look at what's going on. Call for help if you need it. Do what you can to protect the person from getting hurt any worse. Be a comforting presence. And just keep an eye on them until the paramedics arrive. That's it. That's the foundation.
And that's it. That's our walkthrough of first aid essentials. We've covered the red alerts, the sudden events, and the key warning signs. So I'm going to leave you with the same question we started with. Now that you know the first steps, are you ready to take them?